Good day, I'm Xuesheng from South Africa in University of the Western Cape Chinese Medicine Program. Thanks for inviting me present in the Third World Traditional Medicine Forum. My topic is to introduce traditional African medicine and the traditional Chinese medicine in Africa. Introduction of Africa traditional medicine and traditional Chinese medicine in South Africa. South Africa is extremely rich in plant resources, having more than 30,000 plant species. 3,000 plant species are used in their medical value for their medical values, including more than 130 plant species, which are widely used in traditional medicine. In Africa traditional medicine in South Africa. South Africa traditional medicine, abbreviated as ATM, practiced by the traditional healers, is currently utilized by approximately 62 to 80% of South Africa populations. It was established there are roughly 200,000 traditional healers in South Africa, particularly in the rural area. In South Africa, traditional healers are known as Ianga, the herbalist, and Sangoma, the diviners, and in formerly a crucial part in provide healthcare in most Africa, to most South Africa in the rural area particularly. And from the pictures, we can find the herbalist is more more males, and the sangomas, the diviners, are more the females, women's. And it is known that both the men and the women are became traditional healers in South Africa. And then 55% are traditional healers are from the black population, and there is a minority from the white and colored populations. Uh, Africa traditional medicine practice in South Africa. So traditional healers believe that they are called by the ancestors, and they diagnose and treat the patient through the ancestors. Traditional healers are also known to go beyond just treating the diseases. They connect collectively and individually with the patient, lead and guide to them to the healing practice. In terms of the diagnosis of the disease assessment, traditional healers make use of skeleton bones, seashells, and they also make use prayers for the diagnosis. And you can see the shells and the skeletal bones for their diagnosis. Ianga name means the trees in Zulu language. So mainly traditional healers make medicines from herbs, roots, tubes, barks, leaves, twigs, flowers, and seeds are used to treat patient. Also, ground up rocks, animal horns, and bones can also be used to make their medicines. Um, After patients are diagnosed, the herbalist may go to bushes to find particular plants necessary for the healings. And herbs as roots are called muti. So you can see all these herbs, and also particularly the raw herbs are used to treat the diseases. And in terms of the drug administration method, oral administration of infusion, decoction particularly, are most popularly used by the traditional healers to treat the patient. And also we find the water vapors therapy are also used to treat the sickness, particularly like inspiration disease, by the traditional healers in ATM. The African traditional medicine trainings to become a traditional healers, like a diviners or the herbalist, a minimum stand of training for 6 to 12 months are required. At current stage, there is no ATM training institutes, and also very rare ATM training books are found in South Africa. So a trainees trains formally and another traditional healers who act as tutors for a period of a few months to years to train a person to be a healers. So commonly used as South Africa indigenous herbs. Buhu is one of the herbs are very popularly used in Cape Town area. So buhu contains essential oils and has a characteristic smells when crushed. The dry leaves are used for the medicinal purpose. So buhu are used broadly from the urinary tract infection, skeletal muscular diseases like chronic pain, respiratory disease, and digestion disease. And then devil's claw is another popularly used herb in South Africa. So devil's claws are used the secondary root of the plant, and it's collected and sliced in pieces for medicinal use. So traditional healers use the devil's claw to treat fever and then to stimulate the appetite, promote digestion, and devil's claw also used as an ointment to treat skin ulcers. So the research shows devil's claw has a significant anti-inflammatory effects and widely used for osteoarthritis and alleviate the pain in the knee, hips, and the lumbar regions. African potato is also another popularly used herbs of South Africa. So the tubes of the plant are used for the medicinal purpose. And then it's primarily used for the urinary tract infection, upper respiratory tract infection, joint pain, HIV, heart disease. And then research has shown, the RCT has showed the African potato have a significant effect on the treatment of the prostate hypertrophies. So Swazilandia is also another popularly used herb in South Africa. So traditional healers use Swazilandia in the treatment of numerous diseases such as respiration disease, like asthma, cough, bronchitis, and also digestion disorder like chronic gastritis, diarrhea, as well as skeletal muscular disease and the cancer and HIV. Um, so in terms of the traditional Chinese medicine training and practice in acupuncture and in South Africa, in 2002, Airline Health Professional Act was released in the nation, and Chinese medicine and acupuncture can be legally practiced in South Africa. University of the Western Cape established the training program of a bachelor degree in Chinese medicine, And the first enrollment of the Chinese medicine student is in 2003. So University of the Western Cape is the first and only university in the whole African offering 5-year full-time accredited course in Chinese medicine and acupuncture. School of Natural Medicine hosted the Chinese medicine degree and the training program. So the degree of Chinese medicine and acupuncture in UWC is consist of two parts. The first 3 year is Bachelor of Science in Complementary Health. The last 2 year is the specific trainings in a Bachelor of Complementary Medicine of Chinese medicine and acupuncture. The graduate The graduates can register within the Airline Health Professional Council of South Africa and the Board of Healthcare Founders to obtain the registration as a doctor of Chinese medicine and acupuncture with a registration number and practice number respectively. In terms of the Chinese medicine and acupuncture modules in UWC, we have the basic TCM theory, TCM diagnose, acupuncture theory, Chinese herbal theory, Chinese herbal formula, clinical acupuncture, and internal medicine of TCM, gyno of TCM, TWINA, ENT of TCM, pediatric of TCM, surgeon and dermatology of TCM. So it's very similar as the Chinese medicine program, the module in China. And also the community engaged and the clinical trainings are the very major important content of the course, of the program. We have 3 clinical training sites. One is the campus clinic of School of Natural Medicine, Chinese medicine in UWC campus. And we have also the Bevel Medical Centers that is host a Chinese medicine clinic. And we also get a Chinese medicine clinic in a public hospital in Lintahir Hospital as a University of Western Cape Rehabilitation Center and Chinese medicine clinic. TCM and ATM collaboration and knowledge exchange in South Africa. So both TCM and ATM are facing the challenge from the conventional medicine and the globalizations. So how can we inherit our traditional and indigenous knowledge of medicines in the globalizations? And also how can we innovate the ATM and the TCM to modernize our traditional medicine for a better health service in the public health? So in Chinese medicine, we explored to using the indigenous African herbs in the Chinese medicine theory and framework. So we explored and we tried to identify the indigenous herbs in the Chinese medicine series and use it in the Chinese medicine, added them in the Chinese medicine formulas, such as buhu. We identified it as pungent and slightly warm in property, and it entered the lung and the stomach channels. And the Chinese medicine actions is identified as disperse wind dampness, released exterior, diuresis, and block the channel and alleviate pain. So devil's claw is pungent, bitter, and cold in nature, and is enter the spleen and stomach and kidney meridian, and its action are clear the wind dampness, eliminate heat, and unblock the meridians. African potatoes is neutral, bland, and slightly bitter in nature, and is enter the heart, liver, kidney, and blood meridians. And its Chinese medicine actions is identified as tonified yin, alleviate painful urination, and disperse the nodules. Cancer bush is sweet and slightly bitter and slightly cold in nature, and it's enter the lung, heart, spleen, and stomach meridian, and it invigorate the spleen and stomach qi of the lung and spleen, tonify the qi, nourish the yin, clear heat, and generate fluid. So we use these herbs in the classic Chinese medicine formulas and enriched the Chinese medicine practice in South Africa. And also, we try to promoting ATM innovation and systematizations, learning from TCM modernizations. So South Africa traditional medicine is in a special stage, which is in need of developing its own indigenous knowledge system, including a basic and fundamental theory and philosophy of ATM diagnose skill and techniques, herbal mixture and compounding knowledge and skills, as well to find how to record and analyze the traditional knowledge. So we find the ATM and the TCM have a lot of similarities in using herbs, such as they both using the raw herb mixtures to treat the patient. And also many herbal procedures, the understanding of raw herbs are similar. So in the past 5 years, traditional healers and the Chinese medicine doctors communicate, research, and collaborate with each other to explore how to promote Chinese medicine and African medicines together, particularly like to treat COVID-19 at the pandemic, as well diabetes, neurology disease, to try to find and improve both the ATM and the Chinese medicine in Africa. Thanks for this, everything for my presentation. Thanks.